Should. We'll go to Senator Cantwell. Sorry.
Thank you.
Sorry,
No,
couldn't get
thank you,
right to
Mr. Chairman. I appreciated hearing Senator Toomey's remarks. If I could enter into the record a letter from the governor of my state as it relates to this legislation.
Without objection.
And Mr. Chairman, I would say, first of all, thank you to you and the ranking member for the chronic care legislation that you moved out of this committee. While I wish that would have been a more robust debate, at least it's moving through the process. I'm sure that this is the same attempt here to move something forward, but I definitely believe that as we continue to talk about CHIP and the efficiencies of the program, Senator Toomey's point about having CHIP money go to CHIP is, I couldn't be more supportive.
Thank you.
I'd say the same to states that use CHIP money for something else too. If I had a desire, it would be to focus in on the affordability issue as we move forward. Our colleague, Senator Isaacson, brought up his anxieties about other aspects of the healthcare legislation that are needing to be renewed by the end of the year. And so I have a feeling this CHIP bill will become the political football of all political footballs here at the end. But I would hope we would not lose sight on continuing to improve and streamline the cost effectiveness of this program. By that I mean make sure we're keeping focus on covering kids and the adult population that go along with them in the most cost affordable way possible. As a state that has seen the great benefits of coverage but in the most cost effective way possible, that is in the Medicare market getting $2,000 to $3,000 less per Medicare beneficiary and yet delivering better care at greater outcomes, we have been forced into finding the efficiencies in these programs that are so necessary. So I hope as we move to the floor with this that you will consider these discussions on both sides of the aisle about how we continue to make sure that, as you said, all kids are covered and that the adult population that goes along with them in the most cost-effective way, and not be afraid to figure out how to streamline these things together to save dollars and to make sure that they're actually being spent on children. So thank you, Mr. Chairman.
Well, thank you.